Thank you for tuning in to AARP Real Possibilities. If you have questions about Medicare and how it will impact you today, tomorrow, and into the future, then stay tuned. Dr. Sheikh Sharmani,
Yes.
Thank you so much for being here. I know that you've been traveling all over the state and the country talking about something that's near and dear to the hearts of so many older adults and younger people as well, and that's Medicare. And I understand there's some changes and some things that are happening, but one of the things, AARP Michigan recently did a poll, and some of the top priority areas for older adults for this next election was Social Security and Medicare. I think it ranked somewhere between 79 to 81% every time that they polled as a key concern. And so the information you have to share today is important for people of making decisions about which Medicare program to sign up for, what's going to happen to Medicare in the future, financial security. So first, let's get some basic information out of the way. Who can apply for Medicare, and what does it do? Let's start there.
Great. And it's really great to be here with all of you. Medicare is the health program for people in this country who are age 65 and older, certain people under 65 with disabilities, and people with end-stage renal disease. And basically, Medicare covers healthcare needs. It's like a large, health insurance.
Yes, right.
There are different types of Medicare, which is why it is so important that we're having this conversation, because right now is Medicare open enrollment, where it is a time each year where you can go and choose what option works best for you. So there is traditional Medicare, which covers, say, hospital, visits, doctor's office visits, and you can see anybody in the country, any healthcare provider in the country who participates in the Medicare program, which is about 98% of healthcare providers in the country. Then you have Medicare Advantage, which is where Medicare contracts with a private health insurance company to deliver Medicare benefits. With Medicare Advantage, a lot of times you are limited to seeing those doctors and hospitals that are in the network of that plan. So that plan contracts with certain doctors to be able to provide care. So it is very important that if you're choosing Medicare Advantage, that you make sure that the doctors and others who you want to see are in that plan's network, because otherwise the insurance company may not cover the cost of your care with them. Medicare Advantage can also provide some additional benefits, like some dental benefits or hearing benefits. Then there's the prescription drug plan called Part D. I don't know if it's D for drug, but it's D.
That works.
So Part D is where there have been incredible improvements thanks to President Biden and Vice President Harris's prescription drug law, the Inflation Reduction Act. Most importantly, for all of you to know, is that starting January 1st, 2025, for the first time ever in the history of the Medicare program, there will be a limit to what people pay for their prescription costs in a calendar year. No more than $2,000 in a calendar year, which is huge. And it's important to remember that that $2,000 cap is only for covered prescription drugs. So that's why it's so important in this open enrollment, which goes until December 7th, that everybody with Medicare figures out, are your prescription drugs covered by whatever prescription drug plan with Medicare that you are on? Because if your prescription drug is not covered by your plan, then you don't get to benefit from that $2,000 cap. So, and we can talk about like ways to be able to, find a choice that's best for you, but hopefully that helps explain the basics of the Medicare program.
Absolutely. And two questions from that. One of the questions, and I don't recall who asked it, we have a live audience here, but someone asked, there's so many plans out there and there's so many offers. How do you know which ones are legitimate?
Yeah.
How do you determine which one to sign up for, other than what you just said, to make certain that your plan's covered and your doctor's covered in that group? But other than that, how do you know which program is legitimate?
Well, there are 3 official sources of information, unbiased sources of information, because I know there's a lot of marketing that goes on during Medicare open enrollment. We have heard a lot of complaints about misleading marketing, and we have really cracked down on misleading marketing. In fact, we rejected more than 1,000 TV ads for being misleading.
Wow.
During Medicare open enrollment. But there are 3 official sources of information and ways that we can help all of you navigate and figure out what option works best for you. The first is going to Medicare.gov. Medicare.gov, and you can click on Find Plans Now. You can input your prescription drugs and get a side-by-side comparison of different plans with cost, quality, and coverage. So that enables you to make a decision. But sometimes people want to talk to someone. So there's also calling 1-800-Medicare. So you see the theme, Medicare. So Medicare.gov, 1-800-Medicare. Our team is available 24 hours a day, 7 days a week to help you navigate your options. Sometimes people want to meet someone locally, like who they can talk to face to face. So for that, there are state health insurance programs. It's SHIP for short. So at shiphelp.org, you can find a local counselor who can help you navigate. And I think also AARP has support. I know that the Chief Public Health Officer for Detroit, they're bringing in community health workers to various senior centers to be able to provide in-person support. So those 3 avenues, Medicare.gov, 1-800-Medicare, and these in-person counselors are the official, unbiased sources of information so that you can navigate, because you need something that's going to suit your health needs and your financial needs.
Absolutely. So people have to do a little homework. And this is the time to do it. And
this is the time to do it, and it is worth it, because especially with all the changes, the improvements that have happened with Medicare, it's important for all of you to take advantage of that, and have that peace of mind knowing that you don't have to pay more than $2,000 in a full year.
And when you talk about the future of Medicare and all the different new options that are available, another question that came from our studio audience was that there are some new opportunities for caregivers that's related to Medicare. And that excites a lot of us. So would you share those with us, please?
Absolutely. Well, I'm very excited too, because I think many of us are caregivers as well. And we know that people want to be able to be in their homes and in their communities. And it's important that we support the people who are caring for them. So Medicare, for the first time ever, now pays for training for unpaid caregivers, for assistance with activities of daily living. We've now proposed for direct care also, like wound dressing changes, things of that nature, which I think is so important for people to be comfortable being in their homes and for the people caring for them to feel comfortable. But beyond that, coming back to something that we just talked about, the misleading marketing.
Right.
Who is the one who has to help people navigate when they're getting bombarded by misleading marketing? It's a caregiver.
Right.
Prior authorization, the hoops that you sometimes have to jump through with Medicare Advantage, that burden of paperwork and navigating, it's the caregiver.
Exactly.
And so we have streamlined prior authorization. So whatever traditional Medicare covers, Medicare Advantage has to cover. And that also helps caregivers. So I think in so many ways, we really have put caregivers at the center of what we're doing, along with the person on Medicare.
And they have to navigate so many other things already. So the easier we can make it for them to be able to get the information they need and access that information and have it be a trusted source. That's critical.
Exactly.
A question that came up regarding let me just ask the question. AARP advocates for increased access to home and community-based services. We all know that when we do polling, 90-some% of folks want to age in place at home. they advocate for that through the My Choice Waiver program. What is the future of this program as far as increasing access for older adults? The My Choice Waiver program. Are you familiar with that?
I think that is something that's a combination with Medicaid, so that is a little bit out of my purview. However, I will say, and it picks up on what we were just talking about as well, we absolutely are thinking in the Medicare program about how you can care for people rather than just treating their disease in like a 10-minute office visit, right? Because we are all bigger than the sum of our like diagnoses, right? Like we're people, we live in our houses, we live in our communities. So, you know, Medicare now is paying for community health services, food, housing issues, nutrition supports. I mean, those are things as they're related to a care plan that Medicare can pay for. And you mentioned navigating. Medicare now pays for care navigation for people with serious illness. So you could have, for example, a social worker who is supporting a person with cancer, for example, you know, as you're navigating a new disease and you have to get this imaging and that hospitalization and that, specialist. And so having somebody who gets paid to help you get from place to place and help coordinate all of that. So those are some other ways that we're trying to your point, enable people to age in place alongside the direct, supports for training caregivers.
That is absolutely huge. There's just not enough time, and people don't know where to go, how to get the information. So that's why you're being here and sharing this from the trusted source. Tell us a bit about your background. How did you get to be the director of Medicare services for?
Well, and I will say it's also important that we're having this conversation because it's great for my team to put like in a regulation that will pay for, XYZ. But it's also important for everybody to know what's available, right? So that when you go, to the doctor's office, you can say, hey, I need this kind of help. I think Medicare pays for this. Can I get this, right? Like so that you can all advocate for yourselves too. I think that's important.
Absolutely. And that's why it's so important to do this on a television program where people throughout the entire state can hear it and see it and make certain they share that information with someone else so that they're not ignorant of what services opportunities are available for them. But you've got a storied background too in terms of, another, I always do this chicks in charge thing, so we've got, you're in charge of the entire Medicare program inside of the Center for Medicare Services. How did that, tell us a little bit about that journey.
Well, so I'm a physician by training. I'm an otolaryngologist, so ear, nose, and throat surgeon. And I have my PhD in health economics as well. So I've always been interested in both. I love healthcare because I've always been interested in helping people directly, but also being able to work at a policy level where you can impact the lives of, now millions of people. So before I took this job, I was practicing medicine and I led care transformation for a major health system. So community health, case management, care managers, geriatrics, palliative care, diabetes management. These were all things that were under my purview, while I also took care of patients, one-on-one. And, through my policy work, I actually worked in the Obama administration on standing up and implementing the Affordable Care Act, which was really a wonderful opportunity as well. So it's truly amazing to be able to bring my patients' stories to the Medicare program because there are almost 66 million people in the Medicare program. It's $1 trillion a year. And to be able to try to make common sense improvements to the program to really improve the lives of people, that's what it's all about. And that's why I love doing sessions like this because I get ideas from all of you, right? In terms of how can we make it better for you? There's always opportunities to improve. And then similarly, when we do make an improvement, like recently, as you may know, thanks to the new prescription drug law, recommended vaccines are available at no cost. That shingles vaccine, that was $200, $300, no more. But if people don't know about the change, if they had gone, before the prescription drug law and said, what, $200? I can't afford that. And then they don't know that it changed to $0, they're not going to benefit and they're not going to get it. And that's why it's so important talking with all of you and for all of you to talk with your friends, right?
Exactly.
And tell all your friends that open enrollment goes until December 7th.
Right.
Because if you don't make these changes before December 7th, you have to wait for another year. And these are really important improvements to take advantage of.
You know, we hear a lot about Social Security and whether or not it's going to continue to be viable in 2033. The same thing with Medicare. It was like 2036, I think, was the date that we've heard. 11% cut potentially in Medicare. What can you tell us about the future of Medicare and how it will be funded?
Well, one of the things that we really have been working on in the Medicare program is how do we spend the Medicare dollar in a smart way to keep people healthy? And we've been talking about community health. So I'll give an example. In my prior job, I led community health. We had a community health worker who was trained from the very neighborhood that this hospital, is in Baltimore. And we had a woman who came back to our ER 17 times in like 3 months for exacerbation of lung disease. So we assigned a community health worker to her who went to her house and found that her electricity kept getting shut off because she couldn't pay her electricity bill. And so her nebulizer wouldn't work when she didn't have electricity. So the community health worker helped to resolve the electricity issue. And guess what? She stopped coming into the hospital. Like, that's just spending resources in a smart way that keeps someone healthier, right? And I think that is really the goal of what we're doing, where we're trying to take care of people, because when you keep people healthy and in their communities, then you don't have these expensive hospitalizations where, by the way, who likes being in the hospital, right? And I think similarly with the health insurance plans, we have been doing a lot of work to make sure that we're paying them accurately, where we're using the most up-to-date data that we can, that we are also shining light on what their practices are, so we make sure that people are getting the care that they need. And the third way I'll mention is negotiating drug prices. We just finished the first round of negotiation ever in the history of the Medicare program, thanks to the new prescription drug law, where we negotiated the prices of 10 of the highest cost drugs for the Medicare program. And we estimated that doing that will save the Medicare program $6 billion. And importantly, for people with Medicare, $1.5 billion out of their own pocket. So by us being able to negotiate drug prices, that's another way that we're trying to be good stewards of the Medicare dollar, so that we make sure that people have access to the innovative cures and therapies that they need.
That's powerful. I mean, people need to understand that. So you're saying just by efficiencies alone, you'll be able to recover some of that projected loss from 2036, just by...
That's the hope, is that by changing the way that we provide care and by paying accurately, and through drug price negotiation.
What's the one thing that you would tell people they need to do right now?
Right now, people need to go to Medicare.gov, 1-800-Medicare, or shiphelp.org if they want a local counselor, because then you can get help navigating your options and make sure you choose something that works for you. But I'm going to add a fourth, which is tell all your friends.
Right.
Tell all your friends about the incredible improvements to Medicare thanks to the prescription drug law. That $2,000 out-of-pocket cap is huge. No cost for vaccines. $35 cap for insulin each month. Because I think we all know someone who did not fill a prescription or rationed their medications because they couldn't afford it. And it's so important that people know about these improvements so that they can stay healthy.
Young people also involved with Medicare who are on Medicare. Talk a little bit about that, because there's a sandwich generation now where older
Absolutely.
adults. Okay, so talk a little bit about that.
So I think talking about Medicare is important for everyone, because we all know someone in Medicare. We all will end up on Medicare at some point. And especially for people in the sandwich generation, I mean, a lot of people are helping their parents or other, older relatives to be able to choose the option that works best for them. So what I talked about, Medicare.gov, 1-800-Medicare, shiphelp.org, applies for them too.
Absolutely. And it's so, as you just explained, it's critically important for people to pay attention to what plan you're under, what you have, and to sign up before that deadline. Because after the deadline,
December 7th, after the deadline, you might have to wait for a whole year. So just think, I have a woman who I cared for as a physician where we would get on our smartphones and look at GoodRx so that I could try to find a medicine that I could prescribe to her that she could afford. And to think that now she has this limit to what she would have to pay in a year would be huge for her. But how horrible would it be if she doesn't go and look and make sure that her prescriptions are covered by her plan, because then for an entire year she won't benefit from that $2,000 limit. So that's why I go out and tell everyone that they really need to take a look this year, especially at their options.
and thank you for being here today.
Oh, thank you for having me.
Do you own a cottage or some property that you really want to protect? David, how do we do that? And if you're older adult, there's only a certain amount of time you can really enjoy a cottage.
That's right. That's right. Well, there's a life cycle to cottages, okay? And it's a tragic life cycle way too often. See, when you're a little kid, the cottage is magic. Right. Oh, can't wait to go to the cottage. You learn to swim, you learn to fish, that kind of thing. When you're a teenager,
I don't want to go to the cottage.
Yeah, grandma smells funny. Yeah. I don't want to go, right? But you're too cool. When you're a young adult, you don't need the cottage. You've got other things going, okay? But when you have your own kids, a little bit later on, oh, what happened to grandma's cottage? Oh, we sold it back when you were looking to pay the rent or something like this, you see? So all too often, what we have are memories of the cool cottage that used to be, but we've got to get through that young adult phase, okay? Right. When you do an estate plan properly, you get through that phase. You prohibit people just selling off. You've got to have everybody, unanimity, everybody's got to agree on that. And what we found is when you plan for that, number one, you don't lose the cottage to the nursing home, which is routine. It's where the family farm is going as well. But number one, we don't lose the cottage, and we preserve it for that next generation. So it can be as magical for your great-grandkids as it was for your own kids.
I love it. What a great story. People never think about that. So hopefully that's news you can use. Thank you, David. Appreciate it.
Thank you, Paul. Thanks for having me.
CATA's regional mobility solutions can help seniors seize the day. Hear what our riders and community leaders have to say about the value CATA brings to the lives of aging adults.
Well, my name is Barbara J. Robertson. I've been riding CATA ever since 1988. Basically, it's for going to the doctors in the grocery store, and if I have to go to places of church or something like that. Usually, I try to come on first Sunday because that's communion on first Sunday, and I ride Spectran to come here for that. I take it with my goddaughter, so me and her boyfriend, we ride to Walmart together, or we go to Meyer in East Lansing when she goes to the doctors and stuff like that. And I have other people, I have friends in the building that takes CATA. I'm glad they got Spectran because a lot of people don't drive. They can't drive like me. Spectran is the only way I can get around, basically. I have friends and family that do have cars, but I depend on more on CATA. I know a lot of Spectran drivers. They've been knowing me for years, and I mean, I love it. This young man here, he was really patient, really nice, and everything. Yeah, it would be very, very frustrating without CATA, because, I mean, if we didn't have CATA, the people that needs CATA, they would be in really bad shape because it's, how can we get around without CATA? It's really helpful to the community. It helps the elderly. It helps the handicapped people and the blind people, disabled. So it's really helpful because it helps me, and I'm disabled myself. It's very convenient. If you don't have a ride, call CATA.
If there was no CATA, we would have a very big problem because we both have physical disabilities, so we can't walk like really long distances.
If we didn't have CATA, I don't know what we would do.
Many people are looking for alternatives for their loved ones. They may not be able to keep them at home. So there are some options. And thank you for being with us, Darlene, to talk about those options, particularly adult foster home care.
Awesome. Thank you, Paula, for having me. I appreciate this conversation. Yes, it is another opportunity and option for families to have their loved ones stay in a smaller setting as an adult family home. We're located a lot of times in neighborhoods, mature neighborhoods, nice, quiet neighborhoods. The goal is to offer a warm, clean, safe environment and more personal care to their loved ones. Help with, managing meals and laundry, like take a lot of that responsibility away from them. So when they do visit their loved ones, they're visiting them and not helping them as far as with bathing and working. We take that out of the equation for them, so that the loved ones can live a long, healthy life without any worries. And then also the family, they can come visit and participate with the loved one without worrying about all the details.
And that's a family within a family in many ways, right?
Exactly.
It's a much more intimate setting.
Yes, it is a very intimate setting. We call ourselves their personal assistants, our extended family members. We advocate for them, and that's what direct care workers do, advocate for family members. And that's why we need so many more people to come aboard and help us with this, advocation for our older seniors.
Right, we need more direct care workers because
Absolutely.
we're aging, and that's a good thing.
It is, it is.
But we need more direct care workers, so people need to consider that as an option for their career. Thank you so much for being with us today, Darlene, and thank you for what you do.
Awesome. Thank you again, Paula.
All right, today I'd like to talk to you about exercise as medicine. Exercise has been shown to be beneficial in the treatment of 26 different diseases. Here are some ways that exercise might benefit you. Exercise can reduce and prevent depression and anxiety. It can improve short-term memory. It can improve your mood by releasing endorphins. It can increase your lung capacity, your strength, your balance, and your endurance. It can help to prevent falls and fractures. It can help to prevent obesity, diabetes, high blood pressure, and high cholesterol. It can help reduce your blood pressure for up to 4 to 10 hours after exercising. It can release substances that target tumor necrosis factor and rheumatoid arthritis inflammation. It can help improve osteoarthritis pain and function, and may release substances that reduce inflammation and cartilage loss. It can help to decrease stress and stress hormone levels and improve how we respond to stress. It can help stimulate nerve cell growth and health. It can help prevent dementia and certain cancers. And any kind of exercise is really going to be okay. Strength, resistance, or cardiovascular. You should talk to your doctor before you begin an exercise program. Exercise is tolerated and as comfortable. And make sure you avoid exercising on an injured joint, or if something hurts, modify the activity or stop the activity. Thank you.
There was so much information shared today about Medicare. Please check out the websites and find out how you can continue to protect you and your family into the future. Thank you.